So let's start with another high-yield question related to cardiovascular system. So this question is about a patient who is given lisinopril, which is an ACE inhibitor, and we are being asked that what would be the direction of the arrows for the following: number one, renin; number two, angiotensin 1; number three, angiotensin 2; and number four, aldosterone. So at this point, take a pause and think of the likely direction of the arrows and give the answer. Direction of the arrows would be renin upward for angiotensin 1, an upward arrow; for angiotensin 2, a downward arrow; and for aldosterone, also a downward arrow. So what's the reason? The reason is lisinopril is an ACE inhibitor. The reason it causes the blockade of conversion of angiotensin 1 to angiotensin 2. So angiotensin 1 is not converted into angiotensin 2. This results in decreased level of angiotensin 2. And you know that angiotensin 2 causes the activation of the adrenal glands to secrete more and more aldosterone in the states of hypovolemia or decreased fluid status. So when there is decreased angiotensin 2, this decreased angiotensin 2 is going to cause decreased aldosterone. So again, a downward arrow for aldosterone. And when there is decreased aldosterone, this decreased aldosterone is going to cause decreased reabsorption of salt and water, and it is going to cause a relative state of hypovolemia. And this relative state of hypovolemia would result in the development of increased production of renin. So this increased production of renin is indicated by an upward arrow. I hope it makes sense.